there's not one single area that I can say, but I can tell you 2 or 3 areas that I think I feel very proud of. The first is that I was able to head a group of extremely dedicated public health professionals that dealt with COVID at a local level, not just at the state level. The other thing that I think I'm very proud of is the work that was done by the health department to assure equitable access of vaccine in a rural state and get it to all areas of the state. And lastly, it's a personal I think accomplishment in that we managed to put before the legislature a bill making it part of the routine screening of pregnant women for hepatitis C. These women could then access treatment for hepatitis C, and more importantly for me as a pediatrician was that we could identify these babies that had been infected and follow them through to treatment. I think I lived an example of this, and let me go ahead and say what I believe is really important here, is that in order to bring underrepresented minorities, ethnic minorities, racial minorities into public health, we as leaders need to reach out a hand to them. And I think my trajectory here was exactly an example of that. I was encouraged to apply, to throw my hat in the ring, if you will, for this position. I think that had this position come before my desk and I had looked at it, I probably would have said, hey, that's really interesting. I wonder who will get that job. And I wasn't even considering myself as a candidate for this. I think if we want to get more minorities, both racial and ethnic minorities, have more diversity, more equity in public health, it is up to us to actually reach out and encourage the application of individuals for these positions. In that way, we can select those individuals that are most appropriate for the position and increase the ranks of diversity in public health. So taking those steps allows us to form this diverse workforce that really can reach out and can resonate with the population that we serve across the United States. Each of us has unique experiences that relate to the populations that we come from, both ethnic and racial minorities and urban versus rural. And by increasing that diversity in our workforce, we can better serve our populations across the United States. As someone who's been in this role for barely 5 months, I think everything in this role still excites and surprises me. Every day I come to work, I learn something new or something surprising. As a physician, we can impact on the lives of 100,000 maybe people if we're really, really lucky. When I became the Secretary of Health for the state of Arkansas, I realized that my decisions would impact on the lives of 3 million people in the state. And now, through this position, I can have influence on the health care and health of several 100 million people in the United States. So it's a wonderful escalation of my sole desire to become a physician, and that is to, quote, help people, end quote. I probably couldn't get into medical school today because I couldn't write a good essay other than to say, I just want to help people.